you start sending me stuff. I'm like, I don't want this.
I didn't realize you're gonna send me something every day.
Yeah, I don't need my vaginal rejuvenation done.
David starts getting them. I always love that.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Welcome to episode 477 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me, Donna Grindle from Carden, all the way from Georgia.
Oh, yeah. So far away from you.
So I read in the news earlier this week, or maybe it was last week, but like people at the airport can't drive. Like they can't drive the planes. They're running in each other.
It's one of those things where you don't realize how wide your wing is. Or it's like, I didn't realize my butt was sticking out that far.
I was like, man. And of course, it's Delta. So, I'm thinking they just can't get anything right lately.
I know, but it was like, they had the regional jet was in those little turns, and the other jet comes by and the wing hits the tail and just chops that puppy off.
It's a whole new meaning to crowd strike.
But there's always something, man. It's always something.
Yeah. But other than that, things going well?
Yeah, considering, we're building up for assessment season and every year. I wish we could make assessments go all year long. The ones that are the redos,
Mm-hmm.
You're going to do them at the end of the year. And so, I don't know, we're reaching the point where we're going to say we can only do so many assessments. Cutting it off.
Oh, yeah. Well, by then you should be able to clone yourself, so then you can do more.
I've been working on that with my little AI bot. It helps a little. But
yeah.
Who else is going to read the stuff and go, seriously, you think that's okay?
So today we're going to be talking about an interesting topic that I don't think we've talked about a lot, but we're going to be talking about healthcare marketing. And so we just pulled, 5 things to avoid, because there's probably a lot more than 5. Just kind of some common things. Because, you look at healthcare marketing, you've got, okay, how do we market our services to get patients in or let them know what services we have? And in some cases, it's beyond services, it's products and such. But you've got marketing, you have marketing that can happen internally. And then you have marketing that you're potentially exporting out to a vendor to do. Mm-hmm. So they're doing social media marketing for you. They're doing SMS marketing for you. I mean, there's just tons and tons of different ways to do it. And so then you just have to start asking yourself questions like, well, is this PHI? Am I handing this over to people? Does that now make them a business associate? Where is this PHI going? I mean, it's just like, it's a lot. Yeah. So we're going to dive into some of those things and talk about some areas that we see that people are making mistakes in, and hopefully you can avoid them so that your marketing won't get you in trouble.
Yeah, you don't realize, just like you said, there's all the different ways that things are marketed. And I don't know if I've ever told this story, but this will be key to understanding that you got to look at it from a lot of different perspectives. So you're not just marketing to patients. Sometimes you're marketing to other physicians to get them to refer to you. There's that. And like, there's the specialist, and you got things like, I've done seminars before. The oral maxillofacial surgeons want the dentist to refer to them. There's all this stuff about, you just have to make sure people understand what you do and get your name out in the community. And so often I'm at events where I'm doing my little part of the gig, but there's that going on, and I'm used to seeing it. And I have to follow that discussion, and sometimes it's not real exciting.
Mm-hmm.
I mean, come on. You think I'm boring. Anyway.
No, I do not think you're boring.
It's not as bad as I thought it was going to be to talk about cybersecurity. And you know, I've been at conferences where I have to follow a comedian in the morning.
Mm-hmm. Yeah, that's rough.
Yeah. Oh, you know, at least I've got a fighting chance. There are some people that do cybersecurity. I can't imagine what they would be like after, you know, at least I can make a few jokes.
Mm-hmm.
But no, you know, of all of the ones that I've ever had to follow, one of them that was trying to get people to understand about a new service that was being shared in their practice that they wanted everybody else to know about so they could refer them, because apparently it was like they were one of the few in the area that I had to follow. Was an entire presentation explaining vaginal rejuvenation. And then, now let's go to cybersecurity.
Speaking of vaginal rejuvenation, let's go to cybersecurity.
And it's like, I'm looking at the guy that invited me, and he's like, I didn't know. I didn't know. I didn't know. I didn't know. You know, and
I'm sure somehow you tied them together.
I did. I managed to do that. So I was like, they take something that's supposed to be enjoyable and it's not anymore, and fix that. And I'm going to take something that we all know is not enjoyable and try to make it enjoyable. That's all I got. But anyway, it's to me, just understanding how much of that has to occur is big. And a lot of people are only thinking about, and there are cases where physicians are explaining something and they provide information about patients. And yes, I know it's a room full of other physicians. You cannot do that. So,
are we talking about marketing now? Or are we still on vaginal rejuvenation? Okay. I was just wondering.
No, but they're marketing their services and trying to say, look at all these great things, and you should send your patients to us. And there's that.
Yeah.
So you got to be careful. So it doesn't matter who you're marketing to. These things will matter.
Yep. All right. Well, we're going to dive into that because I think it's going to be an interesting discussion.
Yes.
And we'll uncover some golden nuggets along the way, I'm sure. All right. So before we do that, though, we do want to say thanks to those who listen and who donate, because you can do that if you want to. You can go to helpmewithhipaa.com to learn more about us and our respective jobs and what we do during the day to make money. So we can put on this free show for you every Friday.
All right. But before we get started, we do have a PSA.
Yep.
Public service announcement, because we have talked a lot about the national data, like national
public data.
National public data breach, and how much is out there. And there was an announcement the FBI and CISA announced, because they're seeing this happening. And yes, your data is out there. Mm-hmm. We know this. And people are using this data to then tell people that their voter information this is where we got this out of the voter information. So we got it out of the voter information. No, you could get that out of the national public data.
Mm-hmm.
There has been no evidence. They've looked for it every time it comes up. So know that this national public data stuff looks the same. I mean, it's name, address, date of birth. I mean, all of that. If I go look up my own voter registration, that's all I need to know. And, my zip code, all of that's in the national. So if you see, we got this from here, it was just like millions of them were just published. So keep in mind, don't fall for that, because they're trying to get you to do things. Oh, you need to go resolve this, or hey, you can't. There's so much data that has just recently gone out there. They can pull that from all kinds of places. So, reported.
Let me tell you, this is going to be exciting news.
Oh, ooh.
I know. My wife got a sextortion email.
Oh yeah, we forgot to talk about that. Yes.
Yeah. And it was. I believe it was obviously data from the NPD breach. So they had her real name. Well, I'll take that back. They had her name that she goes by because she doesn't actually go. She goes by like a nickname. They used the nickname, which I thought was very interesting.
Oh.
Yeah. Like, that's not her legal name.
Wow.
But they used her. Yeah. So they had that from somewhere. They had our address. They had a phone number they thought was hers, but it was actually like a previous employer phone number.
Okay.
So they had that. They went to, I'm assuming they went to Google Street View and took a picture of the house. Well,
wow.
They think it's my house, but you can't see my house from the road. So they took a picture of my neighbor's house. Little side story here. Years ago when we got swatted, the SWAT team showed up at my neighbor's house because, again, you can't find my house.
Oh, wow.
So my neighbor is always in jeopardy because if people are going to come and get me, they always get my neighbor. Anyway, I know, it's a side story. So the email was basically like a little small paragraph, and it had a PDF file. And of course, my wife's like, I ain't clicking on nothing. And so I'm like, send it to me. So I get it. I have a contained environment I can open it in. So I open it up, look at it. It's just a PDF, no malicious anything to click on. It does have a QR code though that takes you to the to paying inside of the Bitcoin wallet or whatever. Mm-hmm. So there's no actual malicious payload in the entire thing, but the letter goes into saying the normal stuff. Like, we have your email address and we have your actual address. And it says something like, we would rather not have to come request this in person.
Oh, okay. Wow.
Read between the lines there, right?
Yeah.
And then it's, the stuff that you normally see, like, we saw what you were doing on your computer and we have webcam footage of things and you should be ashamed and all that.
Yeah.
And it's funny because I printed it out and I took it to my wife and I was like, Lucy, you got some splaining to do. What you been doing in front of your webcam?
Boy, wouldn't that be funny in today's world of what Lucy could get into, wouldn't it?
Yep. And so they requested an amount of money. I don't even remember what it was to make it all go away.
Of course.
Couple $1,000s or something like that.
Really?
But yeah, it wasn't cheap. But yeah, it was like a sextortion scam. But the data was pretty interesting because of how they did it. Now, they didn't spend a lot of time doing it, but I think just the time to go to the Google Street View, take a screenshot of that, put it in the PDF as an image. If you didn't know any better, you're like, dude, these bad guys, they must have drove by my house.
Yeah.
They got a picture of my house.
I bet they could fool a lot of people that just, aren't aware. But, it'd be different if it was like, grandma who's 85 and gets it than, some 28-year-old that gets it. I mean, it depends on who's getting it. And I'm wondering if they even narrow it down by the age on top of that. But they could probably automate it plucking that picture even.
Yeah, they probably could.
And build the emails. They could automate that whole process, I bet.
Yeah, it's funny because it made several threats during the thing. We'll release the information. We'll do this. Don't go to the authorities. Don't tell anybody. All this, the stuff that we've seen. Yeah. And then the last part of it, like the last couple sentences, it says something to the effect of, "There's a reason why people tell you to put covers over your webcam. Maybe you should think about doing that next time." I was like, well, at least they leave with some cybersecurity tips.
Well, you gotta wonder though. I mean, anyway. So that data is being used. That data is being used. There's so much out there though. I mean, where did they get her nickname?
I That's the one. The only thing I can think of is when you fill out some things, it's like, here's your name. Now, what are you, it asks for your nickname. What are you called or your nickname or whatever?
What name
Sometimes
do you
when I
go
feel,
by?
yeah, when I fill out stuff, sometimes like I go by my middle name. So I'll put my name, my full name. And then it's like, what name do you go by? And I have to tell people my middle name, or otherwise they'll call me by my first name, which is fine. Except oftentimes I don't respond.
No, we're lucky if you respond to the one you go by.
I know. I'm used to people calling me other names. I'm in a crowded room and somebody's like, jerk. I'm like, what?
What? I didn't.
What, somebody told me? Anyway, so I thought it was funny. She was not really bothered by it at all.
Yeah.
And I think because I was making fun of it. Now, if I'd have went to her and be like, oh God, this is bad, she probably would have freaked out. Now, looking back on it, I should have set up a little webcam somewhere and been like, this is not good, honey. I could have called a friend of mine, like, come start beating on the door. And
You would do that. Bless her heart.
give me my Bitcoin, lady. Give me my Bitcoin.
So spread the information that this data is being used. There are so many big, massive data breaches that have hit just in the last, 6 to 12 months. This data is everywhere. And you're going to get things telling you, I get stuff constantly, junk, report junk, text messages, emails, voicemails. It's going to be even worse as we head into the holiday season.
Mm-hmm. Oh yeah.
Just like we mentioned last week. You're going to need to educate people, or it's going to come back to haunt you somewhere.
Yep. All right. So let's dive into some of the things that we're going to be talking about on the marketing side. So for the first mistake, I think it's just not understanding the HIPAA regulations around marketing.
Not understanding them at all, but saying, I know it all.
Yeah. Yeah. Because there's a specific PDF file or site page you can go to from HHS that talks about marketing.
Right.
So it is a specific problem / opportunity.
It is a thing.
To deal. Yeah, it's a thing to deal with. Like, what do you do with marketing? So you don't understand it. So what is marketing? We'll start there. The privacy rule defines marketing as making, quote, a communication about a product or service that encourages recipients of the communication to purchase or use the product or service, end quote. And then it goes on to read, generally, if the communication is marketing, then the communication can occur only if the covered entity first obtains an individual's authorization.
Yeah.
All right. So, which, you probably should be obtaining anybody's authorization to do marketing. You go and you opt into something, you put your email address in there. You typically are giving people authorization to market to you. But
there's the
first
assumption.
thing is, right. So you have to understand, though, and this is where the very first mistake comes in, what's marketing and what's not marketing. Because just because you're emailing a group of people doesn't necessarily make it marketing.
Uh-huh. Yeah.
Of the things that are not marketing, there are some things that the privacy rule does carve out as exceptions to those. And there's 3 categories, and we can dive into them if you want to, but basically, one is communication is not marketing if it's made to describe a health-related product or service that's provided by or included in the plan of benefits of the covered entity making the communication. So that sounds complicated, but that would be the first one. And then the second one would be it's not marketing if it's made for treatment of the individual. And then lastly, it's not marketing if it's made for case management or care coordination for the individual. But again, we're talking about emailing individuals, not like a mass email going out.
Well, but you can have, like, for example, a mass email. We have a new provider at our office.
Mm-hmm.
Okay.
Yeah.
That's not marketing. That's, you're telling them you've got products and services that we can now take more people. We're welcoming so-and-so to our office. Or the like a hospital gets a whole new specialty department. You can tell people about it. You don't have to, but you got to make sure that you limit what you're doing in there. So,
yeah. And here's a little caveat to all that, which is if the communication is in fact marketing and it's done face to face, you don't have to worry about it.
I just can't send it to you.
Yeah. So that would be like if somebody comes in the office and you give them like a swag bag or something like that. So you're handing them all this marketing material, or whatever. You're doing it face to face, then you don't have to deal with all the other stuff.
Yeah. But I mean, that's why it's okay for you to get reminders about regular care, annual whatever. Mammograms come up. Hey, this is October time frame we're getting into here. Breast Cancer Awareness Month. Let's bring up mammograms. So there you go. I've done that. That's a good thing to remember. If you get a reminder to do that, that's not marketing. So
yep. Kind of along that same vein is making sure your marketing staff or marketing vendor understands what PHI is. Yeah. Because you need to understand, are you handing people PHI?
Yeah.
Whether it's internal or external, whatever the case might be, and then how's that being used? And we'll talk more about that in a little bit. But, understanding what that is, the next part kind of that goes along with that would be, what is an impermissible use or disclosure? What does that look like? And what do we do if somebody actually does it? Like, we've got a problem. First of all, can you even identify that it's a problem? And if you are able to identify as a problem, who do you tell?
Mm-hmm. What are you supposed to do?
Yeah. So that would be part of that. And don't assume that your marketing vendor understands HIPAA, even when they tell you they do.
Mm-hmm. That's salespeople. Yeah. Don't you love it when it's like, well, so-and-so does it, and they do all these other healthcare people, so I'm sure they're good.
It's the same problem we have in IT.
Yeah.
Like, well, they do IT work for all these other, medical places. I'm sure they don't be sure. Don't assume. It's the same thing. Because I've seen vendors, especially in the marketing space, where they'll talk about how they're using HIPAA compliant platforms. We're using the HIPAA compliant version of whatever, MailChimp. We're using HIPAA compliant version of this and that. I'm like, okay, that's great. But you haven't talked anything about your own HIPAA compliance, because you are now part of that chain of custody of the data.
Mm-hmm. And how many times do we bring up the importance of vetting them to make sure they do actually recognize it's not the tools you use, it's what you do.
Mm-hmm.
Your own internal things. And do you just take somebody's word for it that something's, oh yeah, it's HIPAA compliant? What does that mean? What does that mean?
Mm-hmm. Well, it goes back to talking about that services can't be HIPAA compliant. A software can't be HIPAA compliant.
Yes.
It's the organization that has to deal with HIPAA. These products and services and software can be configured and used in a HIPAA compliant manner, but they themselves don't. That has nothing to do with it. Like, your organization is what has to be compliant.
Preach it, brother. Preach it.
I did.
Yeah. I like the one where you said you told somebody, the application itself is not HIPAA compliant, but it can be used in a HIPAA compliant manner.
Mm-hmm.
You got to look at it that way. And so many people are like, oh, they're HIPAA compliant. Yeah.
Mm-hmm. Well, there's still this thought that if I use quote unquote HIPAA compliant products, then by default, that makes me HIPAA compliant. Yeah. I can say that we're doing things in it that are HIPAA compliant. Nah, not really. But so that brings us to what about your marketing vendor? Are they a business associate?
Yeah, almost always. And whether you know it or not.
That's, yeah. And how many, I personally know of a number of marketing folks that are getting PHI, that are considered business associates, and they have not a clue what they're supposed to be doing. No.
Wow.
Not a clue. And, even the few that I've brought it up to, like, you probably should look into this. they do the ostrich on me. They're like, I don't want to know nothing about it.
Yeah.
I don't want it.
My client doesn't want me to sign. They don't mention it, so sure, I'm fine.
Yeah. They're like, I'm good. I don't need to know that.
You realize that doesn't help with your liability there at all.
No, not only that, but as the provider or the practice, now I'm in a constant state of breach because I just handed my data over to somebody else. It doesn't matter if they're using it for nefarious purposes or marketing purposes. You give it to somebody who's not able to legally have it.
Yeah, and you're in instantly every single day you are violating HIPAA rules. Every day. 2 of them in fact.
Every day. Yeah. Yeah, because you don't have a business associate agreement either.
Yeah. and so many people don't take the time to make sure about that. And then they just take the vendor's word for whatever it is. And that goes back to that assumption that they do truly understand. And the ones that do, on top of the marketing, do the, quote, reputation management, those are the ones I also worry about.
Yeah.
Those are the ones that are monitoring social media for, things being said about you and making sure that they're being addressed. But that means that they're potentially interacting with patients that, it becomes quite complicated. They're interacting with patients on your behalf about something that patients put on social media. And we've talked before, when the patient puts it out there, they're allowed to. You are not. And if they're doing it on your behalf, then they're a business associate. So it gets very complicated.
So what do you think about when you're collecting, let's say, email addresses? If the patients are filling out the information like on your website and they're putting their name and email address in, and they're saying, I want to get your newsletter, for example. So what are your thoughts on that being, is that PHI at that point? Or is it only once it gets into the system and you've identified that they are a patient? Because I could be a non-patient and fill that out.
And ask for the newsletter. Yeah. See, and that's true. But what that says is I have a database that has both patients and non-patients in it.
So how would you treat said database?
I would err on the side of caution always. Always.
Yeah. So it's kind of like if there's any PHI, it's all PHI.
Yeah.
It's kind of how I look at it.
Yeah. I mean, you can, if you're not going to err on the side of caution, at least make sure that you have documented why you believe it's okay. Why do you believe that this is not PHI? If I've got, they are my patients. Now, if I buy a collection of data and it happens to have a whole different ballgame. I didn't create that data, and even if somebody enters it themselves, it's still, I gave them the form to give me the information. So create, receive, maintain, transmit. You did one of those knowing it was a patient, not I grabbed all of the people that live in this zip code. Totally different ballgame.
Right. Okay, cool. So the first thing we mentioned was not understanding HIPAA regulations. And obviously that is a big one. And so we'll narrow it down now and go to number 2. So the second thing would be just not obtaining patient consent.
Oh.
And we touched on that, but okay. So what do you do? When do you obtain patient consent? Now, certainly you've got the thing on your website that's like, hey, you consent to being emailed because you filled out this form. And then you've got, okay, people come into your practice and they fill something out. And this is where I've seen it kind of slid into the NPP. All right.
Yeah. And you got to be careful doing that. Is like when we're working with folks, we go through the list and say, what kind of things are you going to want to communicate with patients about? And so often it's like, can we email you about your appointments? Okay, I have said I'm only going to email you about your appointments. And then you start emailing me about other stuff. I got a problem with that. So I recommend that you say, you just have a list and have them check it. you have because most of them are digital now, so you can have, we can contact you about, blah, 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 the following things, and you have a box, select all. That's what most people are going to do. But people like you and I are going to go through and go, okay, I'll allow that. Nope, not checking that box, checking this box. You can do this. And it shouldn't be just a blanket thing that because I've allowed you to send me text messages, you can also now send me text messages about marketing. No, I want you to text me about my appointment. That's it. That's it. So,
yep.
It's a big thing. And you have to give people the ability to opt out, even if they did consent.
Yeah. Like, how can I withdraw that consent?
Yeah.
I filled it out. You start sending me stuff. I'm like, I don't want this.
I didn't realize you were going to send me something every day.
Yeah. I don't need my vaginal rejuvenation done.
David starts getting them. I always love that. There's so many stories back in the day when I did billing work and I would go through and, this claim got rejected. Well, you didn't do a pap smear on David Sims. But I mean, it's a similar kind of scenario, is that I want to do personalized, and that's what everything's about these days. I want it to be very specific for me, but I also don't want to give you any of my information.
Right. I know. It's tough.
Yeah. So
all right. So we get to the point where we have the patient give us consent. We understand the rules. Now the next one is not safeguarding that patient data.
Right.
Because now they've given it to you, and what are you going to do with it? How are you going to protect it? Because it then becomes EPHI, no matter where it flows. And I think this is one of the areas I see people having a challenge, because when you have a conversation like, where is your PHI created? Okay, they know that. Where does it go? Well, it goes into the EHR. Okay, where does it go from there? They start giving you all these places it goes. Then you say, well, how about your email marketing? And they're like, oh no.
Yeah, that's that. One of the reasons why we ask, who are all your vendors? Don't tell me I'm going to give you just the business associates. I want to make sure that you haven't missed business associates. And then sometimes I get business associates that aren't business associates, but they signed it anyway.
Yeah. Well, it's like, you uploaded your entire patient list into an email marketing platform. Ruh-roh.
Yeah.
Hope you did that right.
Yeah.
I'm using the free version. Oh, that's not good. I can go ahead and tell you right off the bat. That's not good.
Wrong. Yeah. So it is absolutely a moment where you need to understand, and this gets back to when you're doing your risk analysis, your assessments, you need to understand where your data is going. This is one of the places and one of the reasons. And it's these little and what is it? They're on the edges,
the periphery,
of PHI, where you think about your PHI and everybody's like, well, our EHR is blah blah blah. PHI is everywhere else. It's like the people that would tell you, all our PHI is in the cloud. We don't have to worry about it. Okay, but you do marketing to your patients? Wait, what? What? So yeah.
Yep.
Where does it go? How does it live? Who has access to it? All that stuff.
Yep. So let's assume that you are doing that right, though, and you've identified that, you know where it's going. So now you got to look at, how are you protecting that data, or that platform even? Like, do you have MFA set up? Are you using strong passwords? It's the same type of protection that you need to have on your EHR platform, because it's got patient data in it. Is the data encrypted? Do you know anything about the encryption? There's all this that's going on. And guess what, Donna?
What?
Your EPHI in marketing should be part of an accurate and thorough risk assessment.
Well, I'll be.
Yep. So when you're doing your risk assessments, you definitely need to look at your marketing, whether you're doing it internally, externally, and making sure that that meets the proper HIPAA compliant regulations. Okay, so let's dive a little bit deeper into the vendor platforms, because that's the number 4 one is not using the secure online platforms or secure vendors. So we've mentioned this, but if your marketing vendor is a business associate, they've got to sign a business associate agreement.
Yes.
And so now you've got to also do your due diligence. Mm-hmm. You've got to potentially look at their HIPAA program, at least as much as you can. Mm-hmm. They become just as much of a business associate as your IT vendor or other vendors that you're handing that data to.
Yeah, they're still associating your name with these people.
Yeah. And like I said, I run into a lot of small marketing firms. They don't do any of this. They're marketing to healthcare or marketing for healthcare. They're not doing anything HIPAA related. They're not signing business associate agreements. They're just completely bypassing all of this.
Right.
So you've got it's a bigger problem than I think most people realize.
Well, yeah, I wholeheartedly agree. Now, there is one little bitty spot where they could do this, is that all they're going to do is they're going to create the list of people from the list that they have access to. That's the public data they have access to. They're not going to get the data from you at all. Mm-hmm. You're gonna contract with them to send this information out to everybody who is between the ages of 34 and 54 in this zip code. They're gonna go get that list. They're gonna send that information out. That's not PHI.
Right.
It didn't come from you. So if you're not going to give them any of your data, great, you're good. But the minute you give them the data, where did you get that data? That's a whole different world.
Okay, so let's throw a scenario in there. Let's say that you're the marketing firm, and the covered entity has all their patients' information in Constant Contact or MailChimp. It doesn't matter. They got it in this email marketing software. The covered entity is the one that has the relationship with the email marketing vendor. They simply want the marketing company to come in and manage sending the marketing messages to that list. Mm-hmm. So the marketing company's not collecting the PHI. They're not storing the PHI. They're not doing anything other than coming in, throwing the email stuff in there, picking the segment of who to send it to, and clicking send. Mm-hmm. Is the marketing company still a business associate?
Yes, because it's still PHI that you're giving them access to.
Yeah, there you go.
Yeah. So, we don't store any. Well, still, do you have access to it? Mm-hmm. If you can access it, you can take it and do things with it.
Yeah.
So you have persistent access to PHI. That is where the line starts. It's hard to say you're not a business associate the minute that we say you have persistent access to PHI. Mm-hmm. Right? There are still gray areas and still areas where it falls under. Now, unless I can say it's, coordination of care, well, this isn't it. So it's not going to be that. It's not going to be, a whole long list of anything that has to do with actual care. So that is the vast majority of where those scenarios where you're not a business associate and you're allowed to have the data. Mm-hmm. Have access to the data.
Right.
So.
Okay.
There you go, David.
Yep. So we talked about having the EPHI online and the vendor is a business associate. They also have to be compliant. Okay. Now, assume all that's right. And they signed a business associate agreement. You still have to make sure that the software is configured correctly to adhere to HIPAA standards. Back to what we were saying earlier, is the software can be used in a HIPAA compliant manner. That doesn't necessarily mean it is right out of the box.
No.
Mm-mm. And we see this where people say, well, I got the HIPAA compliant version. Great. Did you configure it? properly? What do you mean? What do you mean configure? I thought the HIPAA compliant version was already configured properly. No, not always.
Yeah.
Oftentimes it's the HIPAA compliant version simply means you're paying enough money for the vendor to say, we're willing to take on the liability. That's often what it means. You're not getting a different version. You're just paying a higher price.
Well, and there are cases where the vendors, you're supposed to be set up on a different server. You're supposed to be, in particular, a lot of the cases where they have servers around the world where they run things on. And if we're doing HIPAA, we're going to keep it in the United States. One of the things that you should ask in your vetting is my data staying in the United States? Because that then means I'm going to be on X, Y, and Z server, and that's the only place my data will go, which is not the case if I don't fall under that HIPAA banner. And if you get set up and you're on the other, even by and I've seen this happen. Oh, we tried it. We didn't put PHI in it. We did a trial. And then we signed the BAA, but nobody recognized the trial was the consumer version that wasn't HIPAA on the HIPAA servers, and nobody moves them.
Right.
So it's little bitty things like that that'll catch you.
All right, the last one, number 5, we're going to bring it closer to home. Let's talk about the websites and social media. So not securing the website forms or other types of communication, not knowing how to do that. Now, we've talked recently about the metapixel, which is still a thing. So you've got that issue, but you also have to be, you mentioned this earlier in the episode, which is being mindful of how you can and cannot respond to social media posts and online reviews, because we've seen OCR get involved in the online review thing.
Oh my God, yes. So, I've had cases when we've done an assessment and we look and there's this chat thing, and it's really designed to just ask you about your services. If that's all I'm doing, I'm just asking about the services, one would think that's okay. But not necessarily if I'm connecting me as an individual to your services and I tell you what my problems are and what I need from you. Now I'm into a very, very gray area. And so we start asking questions. Okay. Well, what are you collecting there? Are your actual patients going there? Do you know if your patient? Well, our patients use it sometimes. Okay. Right away. Now I'm almost certainly dealing with PHI, and if it is our patient and they're saying who they are and providing all this, where does that data go? Oh, well, it's HIPAA compliant. Yeah. Yes. But where does it go? Where does it go? How does it? And you start asking a lot of questions and the vendors can't answer them.
Yeah. Because even if the vendor says, yes, we'll sign a BAA and yes, we're HIPAA compliant. Well, what about where do they store the data? Because typically they're not actually storing it. They don't have their own servers.
Yeah.
Right. They're doing something. So do they have business associate agreements with those vendors? Are they making sure that's secure? Oh man, it can go on and on.
I've had cases where we start asking the questions and the vendors' answers are so vague that I've had that our clients are like, turn that off, turn it off, just turn it off. Because there is no way the value I'm getting out of that. And that's the key piece. You need to balance what is the value. Oh yeah, I got this cool thing on my website. Is it being used? Because if it's not being used and it's iffy, then why have it? So that there's a lot of variables that you have to have in there. And then you get to the social media part of it, and there's social media marketing. I was on social media doing, my work stuff, and poof, all of a sudden one of our clients pops up in there in the ads. And it just got me tickled, because it's just kind of a weird moment. Like, oh yeah, and I know that marketing program and I know how that's doing that. And so I know how that's happening. why it's putting it on there. But at the same time, you have to wonder, in the cases where no one's asked any questions and it's going out on social media and it's going over here and I'm sending you emails and I'm sending you text messages. That's a lot of systems.
Mm-hmm.
So,
indeed.
Yeah.
Indeed.
Yeah.
So it's a lot to consider, this is the whole point.
Right.
Like there's a lot to consider here.
Yeah.
Okay. So here's another problem I see too with the website stuff is when they have forms on there. Like I want to have a patient intake form on my website.
Right.
And used to it was, I'm going to click on this link and they're just going to download a PDF and they'll fill that out and they'll bring it in, which, okay, if you're doing that, completely cool. Because the PHI information is not going to your website. They're just downloading that form, printing it out, filling it out at home, whatever, bringing it in. But what we see more and more now is they're actually filling out the forms on the page and clicking submit.
And if I'm able to do that, I need to know everything that happens about a lot of things, like who's securing the page where the form is.
Yeah, because now you're going into, you're going away from marketing a little bit. Now you're talking about your website vendor.
Yep.
Because your website vendor, here you go, you say, are you able to put a form on my website so people can fill out the form and submit the information? Your website person is going to be like, absolutely, we can do that.
Yeah.
Yeah, we can do that. But they don't realize what you just did is, though, you've said, can people put PHI on the website and hit submit? Now you're like, okay, where's that information going? Now you've completely changed the game.
Yeah. Yeah, absolutely. And that is the steps you have to go through. You need to think through the process, the entire workflow. Think through the workflow the whole way. That's the only way to know where data's going and what data is going, where it goes.
Yeah. So one of the things I recommend, and also talking about your website, guess what? You're supposed to have your notice of privacy practices there. And it should be easy to find.
Yeah, I shouldn't have to work so hard to find it like I do sometimes.
Yeah. It's like, just put it in the footer that shows up on every page.
And it should be current.
Yeah, it should be. And there's, again, when you go and you're talking to whoever's building your website, they probably don't know to make sure you have that. Mm-hmm. And if you don't know and they don't know, nobody knows.
Yeah.
But really it boils down to this, which is if you do have a marketing plan and strategy that takes security and HIPAA into account and you follow it, you'll be fine most of the time.
Most of the time. But you have to evaluate those vendors on a regular basis. The tools change, the rules change. You have to make sure that they are paying attention. Like all of these vendors, most of them, I would say 98, 99% of them have no idea that we're talking about CPGs and upcoming HIPAA security rule changes. They have no idea.
No. Even if they are doing healthcare marketing, they're not paying attention to compliance. They either don't believe it applies to them or it's just not their focus.
Well, they have that it's a checklist. It's a one and done. We do our annual training check.
We're doing marketing. We're not doing healthcare.
I know, right?
Yeah. But it's the same problems that we had in IT. It's a lot less than it used to be. But you recall when you and I started doing this way back in 2012, 2013, we had to go through a long and painful period of getting IT companies and MSPs to understand HIPAA absolutely applies to you.
Yeah.
And now you don't see it too much anymore where they argue with you.
No, not so much. And if they are arguing, you got a big red flag. Move along.
Yeah. But, marketing is the same thing. Digital marketing is the same thing in most cases. And it is still the Wild West when it comes to those vendors.
Well, and
at least that's been my experience.
Well, and the whole, just the website tracking stuff. because so often the marketing people are involved in the website.
Yeah.
And your informational website is one thing. It's what are you doing with the data that's being collected on the informational website?
Yeah. And the people, I mean, there's been a few companies I know of that they do specifically healthcare marketing. It's not like they do everything else and just a healthcare vendor or practice comes in. They specifically do healthcare marketing. And when all this Metapixel stuff came around, I was emailing them because I have a few of them that are just friends and I try to help them along the way.
Because you're a nice guy.
You might want to look at this. I think they hate getting emails from me, but I sent it to them. I'm like, are you guys aware of this whole Metapixel thing and how it's, what it's doing in healthcare? And none of them were even remotely aware of it.
Wow.
Yeah. So it's a problem.
Yes. Indeed. We should all worry about it.
Yep. But that's all I have. So that's the 5. So I'll just recap them real quick. Number 1, not understanding the HIPAA regulations. Number 2, not obtaining patient consent. Number 3, not safeguarding patient data. Number 4, not using a secure online platforms or secure vendors. And then number 5, not securing website forums and communications, which would be social media. Not understanding what those need to be, what you can and can't do.
There.
So yeah, there you go. Those are some 5 things to really look out for when you're doing marketing, whether it's in-house or outsourcing.
Wow. You did good today, David.
Well, thank you very much. Thank you very much. All right, folks, that is our show for today. Thanks for listening. Be sure to join us again next week. And remember, HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.